Hello everyone, today our topic is pharmacodynamic interactions. Drugs that have similar pharmacodynamic actions may produce an excessive pharmacological or toxic response. For example, central nervous system represents such as a combination of narcotics and antihistamines can produce increased drowsiness in the patient. Drugs have anticholinergic effects such as promethazine and OTC antihistamines can cause excessive dryness of the mouth, blurred vision, and urinary retentions. Drugs that prolong the QTC intervals have much greater risk of causing QTC intervals give together. The pharmacodynamic effect of one drug can be antagonized by the opposite pharmacodynamic effect of a second drug. For example, the antihypertensive effect of beta blockers can be overcome by the use of vasopressor. Obviously, this can have a deleterious effect, be a therapeutical failure or be a therapeutical strategy in clinic treatment, depending on the situation. Drug therapy can produce or adverse effects that result in increased sensitivity or toxicity when other drug is given. For example, the alteration of electrolytes concentration produced by diuretics such as thiazide derivation while deplete potassium, resulting in sensitization of the hair to digoxin therapy. Depletion of sodium via diuretic can also result in lithium toxicity. Drugs that prolong the QTC interval have much greater risk of causing QTC interval when given together. The pharmacodynamic effect of one drug can be antagonized by the opposite pharmacodynamic effect of a second drug. For example, the antihypertensive effect of the beta blocker can be overcome by the use of vasopressor. Obviously, this can have a deleterious effect but be a therapeutical failure or be a therapeutical strategy in the clinic treatment depending on the situation. Therapies that have intrinsically opposite effects on the same target system can result therapeutic failure. For example, naloxone competes with narcotics at the narcotics reception site, resulting in therapeutic failure of narcotics-based analgesia therapy. Pharmacodynamic drugs interactions also can occur with drug-herbal interactions, drug-food interactions. For example, by ingesting large amount of vitamin K in the diet, the effect of anticoagulations by warfarin in antagonize. Starting and stopping therapies that influence metabolism of the other drug can result in therapeutic failure if the induced metabolism reduces the blood level of the target drug. For example, starting a patient on a nicotine patches replace smoking of a patient. Since the patient is no longer smoking tobacco, the CYP1A2 isoenzymes are no longer induced and the substrates of CYP1A2 system may be increase the toxic level. This effect can occur in several enzyme systems which stop phenytoin inducer of several CYP enzyme systems. Starting and stopping therapies that influence metabolism of other drugs can result in therapeutic failure if the induced metabolism induces the blood level of the target drug. For example, starting a patient on nicotine patches replace smoking for a patient. Since the patient is no longer smoking tobacco, CYP1A2 isoenzymes are no longer induced and the substrate of CYP1A2 system increase to toxic level. This effect can occur in several enzyme systems which can stop phenytoin inducers for several CYP enzyme systems.